The third disorder under this category is intermittent explosive disorder. So if you briefly think about this person, this is someone who has a lot of difficulty controlling his or her temper. So this is a person who's impulsively angry. So meaning he does not mean to hurt people or say mean things or explode in anger. And usually he's very remorseful after, but he just can't control it. Okay? So yeah. So for a diagnosis of intermittent explosive disorder, so take note, remember the term explosive. The person should exhibit recurrent behavioral outbursts representing a failure to control aggressive impulses as manifested by either of the following. So he or she may fall in under A or B. So you'll notice the difference in terms of the severity of the symptoms. Under category A, there's verbal aggression. So the person throws tantrum, has verbal arguments, or fights with you verbally. So always nakikipagsagutan, dami-daming sinasabi. Okay, nag-wild through words, kumbaga. Or physical aggression towards property, animals, or other individuals. And it should occur twice weekly for a period of 3 months. So short period lang, okay, but it occurs very often. And these are medyo lighter na aggressive episodes, no? Aggressive impulses. The physical aggression does not result in damage or destruction of property and does not result in physical injury to animals or other individuals. So if you think about it, the person gets mad, the person says a lot of hurtful things, or the person does something, so exhibits physical aggression, but nobody ends up with wounds or with bruises. Nobody ends up in the hospital. Okay, so that's the general picture. But it occurs very often in a span of 6 months. So imagine every week, twice minimum nagkakagulo sa isang lugar. Most especially like sa bahay. Or it can fall under B. So in B, there are 3 behavioral outbursts involving damage or destruction of property and or physical assault involving physical injury against animals or other individuals. And it occurs within a 12-month period. So for example, in 1 year or 12 months, there have been 3 behavioral outbursts that are really severe enough to cause damage or destruction to property. So, yung tipong yung bahay nyo, ang daming nagkabutas na, or let's say yung cabinet nyo natumba, nawasak, yung mga kutsara, mga plato, okay, basag, okay, or physical assault. So that may be, somebody, okay, the person you targeted for your physical assault ends up with bruises, ends up with cuts, ends up with, black eye or wounds, or ends up in the hospital, basically. And that occurs thrice, a minimum of 3 times in a span of 12 months. So either A or B, okay? And the aggressive outburst is grossly out of proportion to the provocation or to any precipitating psychosocial stressors. So, pwedeng he or she did not start it, but even if somebody else started the fight or started an argument, the extent to which the person got angry is extreme in comparison to the precipitating event. Okay, so maybe the person is upset because of a psychosocial stress. Okay, like somebody was annoying at work, or you were very noisy in the other room. Pero you could have shown some behavior that was less severe than this. Pero yung galit na galit ka, grabe yung temper, you're so worked up, then that points to intermittent explosive disorder. Okay? Another one would be the outbursts are not premeditated. So meaning you did not think of this ahead of time, hindi siya planado, and you are not committed to achieve some tangible objective. So for example, if nagwa-wild ka because may gusto kang makuha out of it, okay, so you want them to give you money, and you know that if you throw a tantrum or if you verbalize your aggression, they are gonna give you money. Then that's not it, because ito is really just you can't control your temper. So the recurrent aggressive outburst cause either marked distress in the individual or impairment in occupational or interpersonal functioning, or are associated with financial or legal consequences. So take note that it causes you a lot of distress. So if you're the person losing your temper and always getting angry, always getting upset, it also causes you distress because hindi mo nga sinasadya. So usually what happens is you end up really guilty after. So parang yung tipong ang dami mong sinabing masama sa tao, and then right after, when you see the damage you've caused on other people, you feel really guilty about it because you know you didn't mean it, but you can't help yourself. The next time something provokes you, you just get so worked up again, you get so verbally abusive, or you physically hurt other people again. Okay? So the chronological age is at least 6 years old, because when you're younger, tantrums are more common because you're not expected to have learned a lot of emotion regulation skills. Okay? So you should be at least 6 years of age. And recurrent aggressive outbursts are not better explained by another mental disorder, such as major depressive disorder, bipolar disorder, disruptive mood dysregulation disorder. So these are mood disorders we'll be talking about in the next chapter. Or it should also not be caused by a psychotic disorder, antisocial PD, especially if you're talking about antisocial PD. That's really more manipulative rather than just plain inability to control emotions. Or borderline PD, another personality disorder that we're going to talk about in the future. Okay? Or it should not be because of a medical condition. So sometimes, for example, if you've had traumatic brain injury, then sometimes you get worked up and upset. Or if you use a substance, or if you're on drugs, sometimes you also get temper tantrums. So you have poor ability to control your temper. Okay? So if you compare the three disorders, we come up with this table. So just to clarify the difference among the three. So if you look at the criteria, in conflict with figures of authority or other people, yes, because that's the main feature of disruptive and impulse control disorders. So all conduct, oppositional, and intermittent explosive, they're all in conflict with figures of authority and other people. They have difficulty with their relationships and interactions with other people. Aggression towards animals and other people, for conduct disorder, yes. For oppositional defiant disorder, no, because usually it's really just you like to defy and disregard and annoy other people, but you don't usually resort to hurting animals and other people physically. In intermittent explosive, yes, but it is impulsive. So meaning, bigla-bigla, hindi siya sinasadya. Sa conduct disorder, very often sinasadya yun. It's premeditated and naplano siya. In terms of destruction of property, for conduct disorder, yes. For oppositional defiant, no. For intermittent explosive, yes, but it's also impulsive aggression. So meaning hindi mo rin sinasadya. It's just that you can't help yourself. Next is there is a pattern of theft or deceit. For conduct disorder, yes. For oppositional, again, no. For intermittent, no. And then another was emotional dysregulation, angry or irritable mood. For conduct disorder, not really. So when you can actually be very aggressive, so you can hurt people but not actually have anger attached to it. So pwedeng you're doing it because either it's fun or because you don't care or you want to get back at other people, but not necessarily because you can't help yourself. It's not because you can't control your emotions. In oppositional defiant disorder, yes also, but not as common. Okay. For intermittent explosive disorder, yes, because this is really the one of the main issues of intermittent explosive disorder. They have difficulty regulating or controlling their emotions. Next, premeditated aggression. For conduct disorder, definitely yes. For both oppositional defiant and intermittent explosive, no. And then may cause distress in the individual. For conduct disorder, no. They don't see that it's wrong. It's something that's worth bothering themselves about. So it's not something that's distressing for them. For oppositional defiant disorder, yes, to a certain extent only. So for example, if they feel that they're having difficulty with their relationships and it bothers them, but in terms of disregarding, defying other people, not really. And then in intermittent explosive disorder, yes, it bothers them. It bothers them a lot. It causes them distress because they know they're hurting people, but they didn't really intend to. Okay? So the other disorders that are classified under this family are, one is pyromania. So pyro, fire. And so what that means is that you are a person who deliberately and purposefully sets fires or on more than one occasion. So generally, this person has various paraphernalia related to fire setting. So matches, candles, you have yung, what do you call that? The one that they use for, instead of matches, to light cigarettes. Yeah, so that one. Or things like gasoline, thinners, chemicals that are easy to use when setting fires. And very often, people, before their fire setting, it's like when you're gonna have a date with your loved one. You feel a certain level of tension. It's like a certain excitement that you're about to do something really exciting. So there's a tension that they have to release. And then once they set the fire, there's feelings of pleasure, gratification, and release. Especially when they're witnessing what's going on during the fire. So sometimes this is how people who have pyromania get caught. So sometimes they burn like a structure and then they stay long enough to see the whole thing burning. Like they stay in the car or they hide somewhere and then they'd watch the building burn down. And sometimes someone would catch them with that expression on their face. So that's how they get caught. No, sometimes. Take note, though, that if fire setting is done for monetary gain, so for example, you know that if you burn down your house, you're gonna receive money for insurance, then that's not pyromania because you don't burn things for monetary gain. If you have pyromania, you burn it down because it's pleasurable. Okay, the high you get because of burning. Next, if you want to express socio-political ideology, so let's say, for example, you burn an effigy of our government leaders, then that's not pyromania too. Or if you conceal criminal activity, so let's say, for example, you have misdeeds, you've stolen a lot of money from your company and you have records that might implicate you in the crime. So you burn the building down so that the evidence disappears. That's not pyromania. Or if you burn objects because of revenge or because you're angry at something and that's your way of getting back to them, that's not pyromania. If you want to improve your living circumstances and so you burn your house down because you know you're going to be given a new house by the government, that's also not pyromania. If it's because of a delusion or hallucination, then you should first consider a psychotic disorder before you even go and consider pyromania. And then if you do it because of impaired judgment, so for example, if you have intellectual disability and you accidentally burn something because you didn't know better, then that's also not pyromania. Okay? Uh, the next one is kleptomania. So, kleptomania is when you can't resist your impulse to steal objects. And take note, if you steal objects because you need them, so let's say, for example, you're going hungry, you have nothing to eat, and so all you do is you steal your food every day, that's not kleptomania. Because for kleptomania to occur, you just have an impulse to steal object, but you don't really need those things. And you're not intending to sell them. Okay, it's not for a personal gain. Okay, so there's, like pyromania, there's also tension before committing the theft, and then there's pleasure, gratification, release during the theft when you've successfully done the stealing. Okay, so take note also that stealing should not have been committed to express anger or vengeance, and it's not a response to a delusion. So, for example, you hear somebody whispering in your ear to steal a Louis Vuitton bag, and then you go steal it. That's not kleptomania. That is a hallucination, an auditory hallucination. And so you should go have yourself checked for a psychotic disorder before you even consider kleptomania. Okay? So just read through this. We don't have a lot of data on pyromania and kleptomania just because it's quite difficult and you have minimal number of people who are caught or who have been reported to have those disorders. Nevertheless, they are in the DSM.